Hello and welcome to the Headache Doctor podcast, where on this podcast, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. In today's podcast, this potentially is going to be a little bit shorter podcast, but what I wanted to talk about is something that's really important. It's something that's come up in the past few months or so, and I've realized this trend in relation to Botox and potentially some of the negative side effects. So I wanted to take this podcast episode and talk specifically about what I'm seeing with patients that are undergoing Botox, especially like a series of Botox injections, and then potentially just talking about medication in general and the perspective that we take here at Novera Headache Center when it comes to medication and its role, but Botox specifically when it comes to migraine management. Okay, so the story is that the context for this conversation or for this podcast episode really comes from us being a headache center. Okay, so we're a headache center and we've seen over 1,000 people. We've been in business 5.5 years and all sorts of headaches and migraines, all across the board, all across the spectrum, different types of diagnoses. And it's what we do every day. And we see 8 to 10 people or so every day. As a provider, I see 8 to 10 people. As a practice, we see more than that. But and we have this unique perspective. Okay, so if you think about Botox and how it's utilized currently and in our healthcare system, in our healthcare model, we have, this is big picture stuff. We're not getting into the nitty-gritty yet, but big picture, we have a healthcare system that does not believe that there is really an underlying source, or at least it's not known as far as what the underlying source of the migraine is. And so there's nothing really objective to treat or to do. They would also say that the neck pain is sort of a symptom of the migraine itself. And the treatment for migraine would be to lead you down this path of medication, trialing medication, starting with sort of over-the-counter to maybe the safest or the medication with the least side effects, and then ramping up from there. And then they have different classifications of migraine medication that they might prescribe based on maybe other conditions that you might have, whether it's like blood pressure issues or anxiety or depression or things like that. They might prescribe a certain medication based on your full presentation. Okay, but essentially, migraines don't have a source, or we don't know what the source is. It's a spontaneous neurological event, and the neck pain that you might experience is a symptom, sort of a side effect of having a migraine. And so the medication is the route to go. Okay, so that's the context that Botox comes onto the scene, and Botox is botulinum toxin. It's a toxin. It actually paralyzes the muscles from being able to function. So the myosin and the actin, the myosin and actin are two components of the individual cell in the muscle, and each cell has these myosin and actin components that contract. These are the contractile components of the muscle, and there's different things that happen at the chemical level, like calcium, and so different components come into the cell, causing it to contract, the myosin and the actin to contract. And the botulinum toxin actually like paralyzes it, removes its ability to function. So wherever the Botox is injected, that muscle is basically put out of commission, okay, as long as the toxin is there. So some of the benefits or some of the things that may be of benefit, comparing it to medication, it's a local injection, so it's localized, it's more focused, it's not like a systemic thing. So some of the systemic or the side effects of other medications may not be there because it's more local, it's focused, it's isolated in a sense. Okay, so that's a benefit. it's targeted, so it is actually treating something in a sense objectively wrong. So you have muscle tension and we can take it away. Okay, so provider can feel muscle tension. I don't know if they always do that or not. The one time I shadowed a neurologist that was going through this Botox protocol, they didn't necessarily like feel for the tension. They were just sort of following the spots that I think it's like 32 spots or something that they knew to inject the Botox into. But I mean, you can feel the tension and you can say, oh yeah, that's a sensitive spot, and then potentially utilize Botox in that area. I've done that in the past, just sort of helping guide the physician as they administer the Botox and trying to get more targeted. So it's targeted. It has potentially less side effects. And then the benefit is it can be relatively fast acting because it's pretty targeted. I mean, it's potent. It does what it claims it does. Like, it does shut down the muscle. I mean, it's like it's a toxin. Your body doesn't respond well to it, and it shuts it down. So, yeah, as far as like a muscle that's angry and tight, if you put Botox into it, it'll calm down. Okay, so Botox is known. It's accepted within our healthcare system. It's accepted, I guess, more culturally. I think it's actually perceived, just what I would guess, I think it's perceived as being safer, sort of a safer form of treating it as opposed to medication. It's also seen as potentially more impactful, like more effective. If the medication doesn't work, try Botox, and it's kind of our last resort, but it should work. Okay. And right now, I would say it's one of the best tools that the medical side of things has in order to help someone manage their headaches or migraines. Okay, so those are the positives. That's why it's utilized. That's why it's becoming, I think it's growing in popularity. All right, so the negatives of it, and this is where I'm going to say, like, we have a unique perspective. All right, because we're working on the neck and we're seeing some of these impacts on the neck, but negatives, it is a toxin, so I mean, it's not like a natural thing that your body's going through. It's artificially shutting off something that should be working. The muscle should be able to function. Your brain and your body should be able to utilize that muscle's function. If the muscle's like angry and it's feels overworked, if it's tight, if it can't relax, it's like that for a reason. So it's not as if like, oh, we just shut it off or remove it or whatever. Like, the body is in that state for a reason. So just shutting it off doesn't solve the problem. It doesn't solve the underlying problem. What's insightful is that the fact that it works tells us that there is a direct connection between your symptoms and neck tension. Okay, so like we have to at least acknowledge that. What the medical side would say is like, well, the migraine itself, now that I say this out loud, this doesn't even make sense, but they would say that the migraine itself has the side effect of neck pain. But if you're treating the neck pain through Botox and the migraine gets better, then the reasoning there would be flawed. I'm just saying that out loud. I'm like, that doesn't really make sense. Anyway, I think it further validates that the neck has a large portion, or if not a substantial portion of, like, if we're going to say the underlying cause of the migraine, if Botox is working, that means like something in your neck is the problem that's causing the pain in your head, because Botox is not doing anything outside of just like interacting with the muscle tissue, paralyzing it. It's not doing anything chemically to your brain. It's not like changing something that would make sense to say, oh yeah, it's this spontaneous neurological event, but if we use Botox, it works. Okay, I didn't plan to go down that tangent, but as I was just saying it didn't really make sense. So there you go. That's sort of somewhat of the reasoning that may be thrown out there. But yeah, again, doesn't really add up in my mind. But anyways, further, let's go back to the negatives of Botox, side effects of it. It wears off. So every 3 months, you have to go back and get it again. There is a sense that your body will, it'll become less potent. So as you get repeated Botox injections, it'll lose its effectiveness and its potency. So even if it works maybe the second time or the third time, it's not as if that same result is guaranteed the fourth time, the fifth time, that sort of thing. It's not even necessarily, a lot of times I hear that patients say their neurologist told them it may not work the first time. So you do kind of have to commit to a couple, 3 times to see if it's going to work. So the negatives, as far as like chemically or the medication itself, I mean, local reactions, I mean, if you want to dive into that, I would just Google it, look it up. As far as side effects of Botox, I'm not sure if you go to a neurology appointment or whatever provider that's doing this. I'm really not sure if informed consent is totally a thing anymore. I mean, do people really know what they're getting into? I'm not totally sure. I would probably argue no. Like if you're really knowledgeable about what you're signing up for, not really. And that leads me into the whole reason I wanted to talk about this. So we're a headache center. We see people every day with headaches and migraines. That's all we do. That's all we've been doing for 5.5 years or over that. And so when it comes to interacting with the neck, what I've had the unique experience of is helping someone and allowing them to find relief of their headaches or migraines. And there's been at least one scenario, and this is, it's really interesting. So patient went back, like headaches started to come back years after they stopped seeing us. And then instead of coming back to see us, initially it was like, well, maybe I'll try Botox. Did Botox for 3 or 4 rounds. And then remember that we exist and was like, oh yeah, that place helped me, came back. And what has happened is the neck is much more resistant to change this time around. It's taken longer. Okay. Now, the reason that's interesting, because I was feeling this pattern of patients that would come in and their necks were just a little bit more stubborn than what I would expect their neck to feel like. So at the joint level, so when I say joint, know that I'm talking about 2 bones and interacting. And specifically when it comes to headaches and migraines, it's the head sitting on the first bone, the atlas, and we should have this nodding, a little bit of side bending. And then it's also the atlas sitting on the axis, which should mainly do rotation. Okay, so nodding, side bending, rotation. Those are the movements that we'd expect to be in the upper part of the neck. Now, the joint almost always has lost nearly all of its motion. But most of the people, when we apply pressure to those areas, it'll give a little bit. Like it won't want to move, but it'll have a little bit of give to it. Now, there's a certain percentage, a small percentage of people where I work on their neck and I'm feeling their neck, and it's just their neck feels like it really, like it's just not going to budge. Like I have to put as much pressure as I can, and I repeatedly do it on either side, and I'm just working on getting this neck to budge, and it's just not wanting to give me anything. And the trend that I've seen in this scenario is that these people have gone through multiple rounds of Botox. Now, there's a lot of people that have tried Botox like once or twice. It's not necessarily those people. It's more the 3-4 plus times that have been through Botox. But not to say like 1 or 2. I wouldn't say like 1 or 2 is necessarily okay. Like you're in the safe zone, but the greater the impact of Botox, like the more you do Botox, I think the greater this impact has shown up. Okay. Now, of course, like I don't have like randomized controlled trials, and it's not like I did a blind study with manual therapists working on the neck. I'm communicating this because I think it's helpful, and I think it's fascinating, and it's something where our healthcare system wouldn't really ever catch, because when they're testing to see the impacts of Botox, one, they're looking at like chemically, how does someone respond to this toxin being injected into them? And if it's like a local response, they say that like the skin got red, it got irritated, maybe you had a headache from it. And then, obviously globally, like, does it have any impact on like, all of our vital organs and that sort of thing. But when it comes to like mechanically understanding what the impact is, I don't trust our healthcare system to really understand that. Like, for them to say, hey, we're the Botox company and we want to make sure that we're not having a negative impact mechanically on someone's neck. And we want all these well-versed physical therapists that treat the neck every day to tell us if there's any negative impact over the long term after a year, after 2 years of going through this process. Like, that's not a thing. And I know it's not a thing because as far as physical therapists looking at the neck, like we're a little bit on an island. Like, there are some physical therapists out there, but we're a pretty unique clinic. And then I know how our healthcare system works, and they don't ask the questions of what's mechanically happening here because they don't even think headaches or migraines in particular, even have anything to do with the neck because they're not really sure how to evaluate it. So there's kind of this gap in your ability to understand what you're walking into when you get Botox. And so what I believe is happening. Okay, so here's a scenario. Someone has migraines, which is going to mean most of the time that they have a substantial neck issue. Their neck does not move the way it should. And when the neck doesn't move the way it should, there's a lot of increased stress on the musculature around the neck, small muscles, big muscles, and the shoulders get involved. So everything just has to work harder, all right? And so you develop this tension. Muscles are having to work hard just to keep your head up, to get your head to rotate left and right. And so that problem over time leads to irritation in the neck, muscle tension. Those muscles aren't happy, okay, because the joints themselves aren't moving like they should. And so you try the medications, they don't really work. You go through Botox, and it's interacting with those muscles that are angry, and those muscles calm down. One of the most sensitive things when we're working on someone is muscle tissue. Now, the muscle is not the problem. It's part of it, but it's not the problem. If we just worked on muscle tissue, we wouldn't get the results we get. We work on the joints because the joints allow full function of the neck, and so that the muscles can do their job again. But if we just like shut off muscle function, as like what we're doing with Botox, and we pay no attention to like improving joint mobility, stability of the neck, how the neck functions, how the muscles coordinate, shoulder tension, how the shoulders function, jaw mobility, if you have a tongue tie, if you have an airway restriction. Like if we do none of that and we just say, let's just do Botox and like shut off the muscles that hurt. Well, what happens is that you sort of limit the body's ability to even compensate. So now it doesn't even have the option to compensate, okay? But again, you're still going about your day. You're still going about your life. It's not like you can't do things. It's not like your body says, well, I'm not going to turn my head anymore. And so it finds a way to do that. So let's say, I don't know, just for example, if your compensations are there and then you shut off half of them, well, the parts that are functioning need to work that much harder. But the impact on the neck itself, so on the joints. So again, when we're thinking about joints and needing the joints to move in order to solve this problem, well, Botox isn't impacting the joint at all. It's not like helping the joint. It's taking away the muscles, which are potentially stabilizing and helping with like the movement throughout the day. Well, if you take certain muscle groups away, the impact, the stress placed on those joints themselves, I believe is increased. The compensation level that you have to use increases, and just the stress on the overall neck is increased because you sort of eliminated part of the neck's ability to function. And then if you keep doing that over time, I really think the joints themselves just have this higher level of stress throughout the day, like physical stress, like weight on them, because of like the weight of the head is 10 to 12 pounds. Your neck, the musculature in your neck is there in order to help you manage that. And if we just take that away, the weight of our head didn't change. And so it's like your head's just sort of like rusting on the bones themselves, like without the musculature being able to assist, amplifying the joint problem. And so as you continue to do that, there may be temporary relief because the muscles themselves that were angry are kind of shut off. But we're kind of in this cycle of like things start to come back, and maybe they come back with a vengeance. And then when, we interact with someone like that's been through that and we try to help their neck out, it's like, man, the neck is really stubborn. And here's where it would really be a shame is if we start treating someone in that scenario and it's really stubborn and they're not progressing as quickly. And then they think, oh, this isn't a neck problem. This isn't really my neck that is the issue. Man, yeah, that would be tough because, one, like framing, having this experience as a provider saying, hey, here's someone like you. We may not progress as quickly. Like it's super helpful for the patient because we don't want to give up on something that's actually working too soon. And I don't want you to give up on something that's actually working because it just may take more time. So if this sounds like you and you're like, man, I've done like 6 rounds of Botox and I know I have a neck issue, well, you may just need to be more patient, understanding that your neck's ability to function, it's not as if like it's gone or evaporated or, you're never going to get back to that, but you just might need to give it a little bit more time. To see the same result, or someone who hasn't been through those Botox series of injections may not have to deal with. Okay, so again, this is all experiential. I have no problem with that though. Like speaking from experience, I think it's super helpful for you, the listener, to understand. Because when I'm working with someone, I'm trying to understand like why is someone who's like in their 20s or in their 30s, why does their neck feel like someone who's in their 60s or 70s? Like it just feels so tight and not wanting to budge. And I really just think it's accelerated. For example, this is not unique to this scenario. I mean, we've seen that there's studies that show that injections into the knee or into a joint like the ankle, in order to reduce steroid injections, in order to reduce inflammation or pain, they will actually increase or speed up the rate of early onset arthritis. So meaning like put you at risk for early onset arthritis because the pain signal is there for a reason. And if you just shut off the pain, well, what happens is you start to walk normally and you start to function normally, but it's still dysfunctional. You didn't solve the problem that was causing irritation in the knee, but you just shut off the pain signal. And so you think everything's fine, but you're really just adding stress to something that that your body was telling you, we don't want to put too much weight on this because something's not right. That's essentially what's happening to your neck. It's saying, I'm not happy, something's not right. And instead of acknowledging it and fixing it, we just say, well, we're just going to find a way to shut this off. And then like, physically, mechanically, I think we're seeing the negative implications of that. Okay, so I know that there are people that are listening to this right now, and you're like, well, Botox is the only thing that's helped me, and I get that, and I have a lot of patients in that same scenario. So it may not be like, oh man, and my Botox is next week, I need to cancel those appointments. It may not be like, okay, as drastic as that, but what I want the listeners to do, what I want you, the listener, to do is like, just start thinking mindfully with the information that I've now provided you into like, do I really need these Botox injections? Is there another avenue where I can help my neck? I mean, obviously if you live in Colorado or if you can reach out to us, we can help you through all of this. And we'd love to do that because, treating it sooner is always better. And it's always going to be easier. So in a similar thread, medication and just the impacts of medication are, I don't need to go into detail with this, but essentially of the same mind. Like they're not benign. They're not without their impact on on your neck, on your body, and the way you perceive pain. And the longer we do something that's not addressing the underlying source, the more at risk we are of experiencing that negative impact. Okay, so there you go. There's my 2 cents on Botox. I don't know if the creators of Botox find this podcast. I don't know. Hopefully they hear it and they're like, oh, maybe we should consider that, instead of like, wanting to get frustrated that I'm highlighting something I'm seeing in my practice. But anyway, I hope you, the listener, have found this to be helpful. And as always, we're on this mission to educate and empower everyone with headaches and migraines, so that you all can break free from a life of fear of your next headache or migraine and dependence on medication. Thanks so much for listening, for writing 5-star reviews, for sharing it with someone that you know who could find it helpful. And I'll see you next week.